and I want to make sure and honor your time. So I'm really excited today about the agenda for the webinar. Kellen is going to talk about policy stuff and the things that we should be paying attention to as this session just started yesterday. So we're excited to see what Kellen has to share. And she's also invited a couple of guests that are going to join her, Liz and, my gosh, the other name just left me, but I'm gonna go ahead and let Kellen introduce them. For just a minute, we're gonna have Jesse Hudson introduce himself. He's with the National Guard, and they have some really great resources to offer, especially with our take back events that we hold. And then just for the record, I put in the chat box the USAVE link to the USAVE document that you can refer to for upcoming legislation, as well as a link to the roll. So please sign the roll if you have not done so. And then I'm going to turn the time to Jesse, and then we'll just let Kellen take it after that. So thank you, everyone.
Good afternoon. My name is Jesse Hudson. I'm the program manager for the Utah National Guard's prevention program, which is called Drug Demand Reduction Outreach. We focus mostly on coalition building. I work with Kellen with her coalition, as well as some several other coalitions throughout the state. So if you guys would be interested in that, I can kind of give more an overview to any coalitions I'd be interested in some National Guard support another time. The main reason that I was asked to talk today was about drug DEA, the DEA's Drug Take Back Day in April. We're coordinating directly with Agent Bianchi, who is the DEA's representative heading the Take Back Day on April 24th. We are planning to assist several coalitions in planning, as well as providing personnel and logistics support for the events. So if there are other coalitions throughout the state that would like to maybe hold that event and would like some additional planning resources, as well as personnel and logistics support, we can definitely help provide that. Right now, I'm tentatively hoping to have events in Ogden, probably 2 in Salt Lake, Pleasant Grove area or Provo area, Manti area, and then in St. George is where I'm hoping I can get my analysts set up. Basically, in a nutshell, if we can get in touch with your coalitions, we can sit on the work group to help plan the event, which I'm doing statewide. And then we would just need at least a little bit of local police department support. Because what we can do is we can help collect the turned in drugs, but we can't take it from the populace. We can take it from the police. So if the police collect it, we can take it and then transport it to DEA. So that's kind of how that works really quickly. So I just wanted to take about 5 minutes, give you guys that heads up. And if anyone is interested in learning more about our program and how we're helping coalitions throughout the state, by all means, reach out to me. And I will open up for just a couple of minutes for questions on drug DEA takeback or on the drug demand reduction outreach program in general.
Jesse, I put your contact info in the chat box for everyone.
So I guess that's it. Hopefully that was quick enough, Kellen. I know I was against the wall.
Thank you, Jesse.
That was great. Thanks, Jesse. I'll just quick say I've been working with Jesse, I think, since March or April, and the National Guard partnership has been really helpful for Magna United. They've done a few events for us, so I would say just take them up on it, and it's just great to have extra manpower on work groups and for community outreach events. So for anyone who doesn't know me, my name's Kellen. I'm the coalition coordinator for Magna United CTC, and then I'm also the new policy chair for UPCA. And so I'm just here today to talk about some policy stuff upcoming for the legislative session and then for Capitol Hill Day in February. But I'm going to start by turning the time over to Elizabeth Kelch, who is the director for USAVE, and she's going to talk about some upcoming bills that we might all be interested in. So I'll turn the time over to you, Liz.
You're muted, Liz.
Sorry about that. I was
Or
having
DUI.
computer problems. Is that all right?
Very minor if it's in the car. One of your
Um,
is a separate offense.
Sorry, give me just one
And,
second. I'm having a little bit
provides
of a
that-
problem.
No worries.
Okay, I apologize about that. I think I've got it fixed. So my name is Liz Kelch. If you look at my last name, it is 3 letters and it is all vowels, or not, no vowels. I mean, it's all. So it is a weird last name, and I was just going to put in, just in case you don't have it, that is my USAVE Google Doc that is tracking bills right now. I have to admit there have been a few bills that were added over the weekend and yesterday that are not included, but I think I've gotten most of them. So I wanted to share with all of you a few things, if that's all right, Kellen. This year during legislative session is going to be a very, very strange year. I'm sure you're all aware of that. It changes almost daily about how it's going to work and how things are going to happen. I think Robin's heard me give this spiel a few times, but I did want to kind of show you how you can participate virtually if you would like. And so oh man, that didn't work. Let me try again. Just show you on the legislative site. So le.utah.gov is the legislative site, and you can see what's going on by going to the calendar. Today, you will see that they will have chamber floor time from 1:30 to 2. And then after that, at 2 o'clock, they'll be holding these meetings. So just I feel bad we're not having anything that's meeting right now, but if it were, it would be in green, and you should be able to connect to it virtually through that. Since nobody is meeting right now, they're all in blue, but you can, with this little icon, you can see what is on the agenda. I don't know why I brought up that one. That one's not important to you. Senate Health and Human Services at 2:07 is probably going to be more important to you. So you can follow this. It has links to the bills that they're going to discuss during this meeting. They are required to post this 24 hours in advance. And so that's why they were a little slow getting it posted for the 2 o'clock meeting. So they have to start at 2:07, not 2 o'clock, because they didn't get it posted till 2:07. So this will show you what they're going to discuss, and they're not allowed to take action on any other bill than what they have on the agenda. So that's how you'll know what's going on and what's happening. Because of the restrictions that we have this week, especially, no public is allowed up at the Capitol. It is closed to the public, only legislators. They are going to reevaluate on, I think, Thursday or Friday, tomorrow or Friday, to figure out if and when they will open up to the public. But as of right now, because of some legitimate threats and also concerns, that's what's happening. If you were to want to participate in person, just be aware that it'll be very limited, that it's 6 feet apart and masks. They will be checking everybody as you go in. It's going to be a very weird year that way. If you want to participate virtually, it is hopefully much easier, and you can do so by you can go to the committee page. So if we wanted to listen to, let's just do Senate Health and Human Services right there, it will show you this page. If you find this, you will see it. And this will show you how to get onto the public electronic site. They're running all of these, I think, through Zoom, or at least the vast majority of them through Zoom, and you can raise your hand and participate and make public comment during the appropriate time. It's going to be a little bit bumpy figuring this all out, but it will, they are committed to making sure that this still is an open and public process, and so they are trying their best. And most committees will have video so that you can see the committee as they discuss and talk about different things. The public is encouraged to participate through Zoom, and like I said, that may change in the next little bit, but it may be the same. All of our legislators this year are going to be tested, rapid tested every morning, and there are some legislators that have opted to participate virtually as well. So there's limitations for everybody. The next thing that I wanted to show you is my spreadsheet. So let's see, and then I lose it because of, there it is. I've got too many things open. So this is my spreadsheet describing hopefully all the bills that are related to substance use, mental health, and other related legislations. As you can see at the top, we have the possible positions for the bills, and then when USAVE took a position on the bill, not the effective date, sorry, it should say the voted date, and then all you'll see the things. I make a new spreadsheet for every week. Today is my day to start on the additional spreadsheet. So just find the latest date and you'll see kind of the more full list of what's going on. But if you wanted to go back and see any sort of discussion that we may have, I have left this as a view only option just because it gets kind of complicated. If you do have any questions or if you have any comments or notes for me, I very, very much appreciate them. If you wouldn't mind just emailing me, and I will put my email in the chat box, but this helps just keep it clean and keep it so that I can share it with my USAVE Council. We meet every Monday from 10 to 11:30 to take positions on bills during the legislative session. And then we immediately go into the CCJJ larger meeting. So that's kind of what happens. Kellen asked me to share a couple of bills that I thought were important to UPCA. So please let me know if you have any questions, but I wanted to share at least a couple of the bills that I thought you should listen or look at and give any opinion that you may have on it. The first is HB 15 from Representative Ray Ward, which, if you remember from past legislation, during kind of our opioid prevention type efforts, Representative Ward ran a bill, I think it was last year, it might have been the year before, about limiting for prescriptions for a 7-day limit. During those discussions and the negotiations with different interested parties, there were a few exceptions to certain controlled substance prescriptions. He has gone back, looked at the data, looked at prescribing practices, and is running a bill that would remove exceptions. So it would keep all controlled substances to a 7-day limit after a surgery. So this would be an opioid prevention type bill. We did vote to support it. Please let me know if you see they are hyperlinked. So read through the bill. Let me know if you have any questions or concerns about that one. Another bill that I'm not sure is a prevention bill, but I would still appreciate any thoughts or anything that you may have is HB 20, which is a driving under the influence sentencing amendments. This is for individuals that have an extreme BAC of 0.16 or higher. They would fall into a higher sentencing bracket and they would receive harsher punishments. But it also includes those that have a 0.05 and any measurable controlled substance in their body, or a combination of 2 or more controlled substances. So the question that I have on this one is I'm concerned on a prevention front if this is actually preventing somebody from driving while under the influence or not. I'm not sure. So that one's kind of a fringe, may not concern you, but if you would like to and like to geek out on all things legislative like I do, that's one I would ask for your opinion on. We have a 24/7 sobriety program expansion for those that are involved in alcohol prevention. This is a pilot program that is in Weber County, but limited to Weber County, that they can participate in a 24/7 sobriety program, rather, especially if they're first-time offenders, rather than having their driver's license suspended or revoked. That this bill would open it up to the entire state rather than just Weber County. So that's one that we are very supportive of. There are quite a few bills that are regarding some controlled substance database access. Representative Hall has one, and then Senator Weiler down in our Senate bills has one as well, that would allow both MCOs and Senator Weiler's bill is for the Utah Medicaid Fraud Control Unit. Sometimes prevention, we like to know that just because the controlled substance database is a very closed, tight group, and so expanding that can be a concern, but that is one that is important if you're concerned about the controlled substance database. We have the Youth Suicide Prevention Program amendments from Representative Brian King, which requires school districts and charter schools to coordinate between youth suicide prevention programs and other prevention programs, and then kind of consolidates some of the funding and makes a comprehensive suicide prevention program. In talking with the Division of Substance Abuse and Mental Health, they have assured me that this is in line with what they are trying to accomplish. So this is working well, but that's one you probably want to look over and make sure that it doesn't affect any of your programming, and if it does, that it's a positive thing rather than negative. Representative Watkins has mental health coverage amendments with that prohibits a health insurer from offering a health benefit plan which does not include substance abuse and mental health disorder benefits. So that's more on the insurance side, but that is also a very good one. Representative Jen Daly Provo has a bill on overdose prevention sites, which allows a county or municipality to approve an entity to operate an overdose prevention program. So this would be like a safe injection site type program. This is a very highly debated type bill, but I would again appreciate any feedback or anything that you have on this one, because this is going to be, like I said, a very highly debated type bill. And she knows that. She ran this bill last year, but she feels strongly about this. So HB 146 is one that I would especially like any feedback on. Representative.
Hey, Liz.
Yes.
Sorry, that I don't know why that came out so loud. There is a question going back to House Bill 26, the one about the 24/7.
Yes.
Craig asked, Liz, has anyone provided evaluation data re the 24/7 project in Weber County? And if so, where could he find it?
So that is an excellent question, Craig, always has the good questions. They are working on that. From what I understand, USAID had very similar concerns and questions about the 24/7. And I am working with Kim Gibb, who is one of our co-chairs for our DUI group. I will be happy to share it with both you, Kellen, and Craig, and anybody else that is interested. Last year, this bill was introduced, and there was concern because there wasn't adequate data behind it. But they have assured me that they have that data now. So I will be sure to share that with you, Craig, when I get that.
Thank you.
No problem. And then Representative Jeff Stanquist ran a bill last year about a drinking while pregnant prevention media and education program. He is just expanding that. So this would take a percentage of total gross revenue from the sale of liquor and make a separate account, which would be the drinking while pregnant prevention media and education program. So that falls in line with a lot of the things that we've already talked about.
Liz, can I ask a question on that one?
Sure, Robin.
So it's going to take a percentage of liquor sales. Is it going to take a percentage of the liquor sales out of other accounts? Or is this going to be, I mean, where's that percentage going to come out of?
So that is a very good question. So it says right here, the department shall deposit the amounts of total gross revenue from sales of liquor with the state treasurer as determined by the total gross revenue for 2 fiscal years preceding blah, 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 blah. So it's 0.2% of the total gross revenue in 2023. And in 2025, it goes up to 0.3. And beginning in 2025, 0.4. So it's just a total gross revenue for liquor sales. In some ways, you could say that that is competing with other prevention things. In talking with some of those groups, they are not as concerned because it is a very small amount. He's not going for, major 10% or anything like that. It's a 0.2% of total gross revenue, but he's looking to expand this account a little bit and make sure that it has ongoing funding because he received very limited funding from last year's bill. I hope that makes sense. So another bill that I thought would be important for prevention is SB 39. I think, Robin, you've heard me talk about this dang bill like 15 million times, but I'm going to keep talking about it. SB 39 came from the Ag Committee, subcommittee. I can't remember what the entire name is, but it expands into the hemp producing side of things, and for the delta-8 tetrahydrocannabinol. So making sure that hemp has an acceptable THC level, that they're not producing or selling a cannabinoid product that is added to alcohol, enticing to children, smokable flower, et cetera, et cetera. In speaking with the co-sponsor of this, Representative Jen Daly Provo, she has said that this has become quite the hotly debated type bill. They thought that this would be a quick cleanup type bill, but it is turning out to be much more problematic. If you are interested in all things hemp, cannabinoid, cannabinol, all of that, especially if you know the difference between delta 8 and delta 9, which I did not, I would love your feedback on this bill because it may get some significant pushback, especially from the hemp producers. They're saying that this bill would effectively destroy their livelihood. So I think it's important that, especially from a prevention side, that we make sure that we have the acceptable and appropriate limitations on hemp, delta-8 tetrahydrocannabinol. And then other bills that I think would be important for prevention to be aware of, there is the Mental Health Crisis Intervention Council from Senator Dan Thatcher that creates this mental health crisis intervention type council that would oversee all crisis intervention teams. And then he's also running a bill, SB 53, which is a behavioral emergency services amendments, which would create the idea of a behavioral emergency EMT tech type person. So instead of calling just out on a 911 call, just an EMT, you could call out a behavioral health EMT to respond. This would all go to the Department of Health to make those sort of distinctions, administer the license, do training, etc. So nothing is spelled out in the bill, but it would go to the Department of Health to determine. So that is important. Senator Kathleen Reby is requiring the Division of Substance Abuse and Mental Health to monitor the additional mobile crisis outreach teams from the funding that was included in Representative Ellison's bill last year. So that is an important one. And then Senator Vickers has the medical cannabis electronic verification system. In talking with Senator Vickers, we discussed this just last week. He says that this bill is quite simple, just making sure that the electronic verification system is able to continue. However, he is considering and has been approached by a lot of industry in the medical cannabis side about expanding prevention, what are they called, the perimeters, or the restrictions on where medical cannabis stores can be, etc. And he hasn't drafted anything because they are still in the middle of a lot of discussions, but please know that that is on his docket. He does have a bill file open. He just has not decided what he's going to do yet. And so we are working closely with him to make sure that it follows all of those things. Underneath, you'll see there are 2 bills that went through the interim committees during interim, and they have not yet been picked up yet. And then we have boxcars. And what boxcars means is that representatives or senators have opened a bill. They have to describe what their bill will be about. So they have a title. You just don't know what it'll be about yet. So these are the ones that I think could possibly be related, and they are at the bottom of my list. A few of our legislators did not win their elections, Representative Hutchings being one of them. We also sadly lost Representative Shurtleff, so we have some replacements coming in there. But I'm keeping my eye out for these type of bills, and will be adding them to my list as they get approved. I'm sorry, Kellen, I took more time than I thought. So that is my short and sweet, but does anybody have any questions for me or anything I can answer? Great. I'm going to just drop my email in the chat. Please let me know if you have any questions, if you need help figuring out how to get on or make comments. I know that this is a weird year, and I am so sorry, everybody. Not that I can do anything, but I've said this like a million times, and I'll keep saying it. This is the year. If you don't know your legislators, now is a great time to reach out to them. But if it's the year of emails and texts and calls, because you can't meet with them in person, but they are concerned. And every legislator that I've heard and talked to are very worried that they understand that the public involvement this year is so difficult that I know that they're going to be concerned. So if you are trying to get a hold of a legislator and you can't get a hold of them, let me know. And I can try and hook you up with their interns or something so that, we can have a good year and like everything doesn't go crazy. That's my goal for this year. Just get through legislative session without everything going absolutely nuts. So thank you, Kellen, for inviting me. And please let me know if anything else comes up. I apologize. I have another meeting that I might need to jump off sooner than later, but I really appreciate the invite to UPCA.
Thanks, Elizabeth, for coming and for sharing all that information. We really appreciate it. I'm going to turn the time over to Elena Walker, who is a prevention policy intern at Southwest Behavioral Health Center. And she is going to talk about some legislators who we can go speak to and a little bit about the Utah legislative process. So Elena, I'll turn the time over to you.
Thank you, Kellen. I'm just trying to figure out how to share my screen. So I actually put together a small PowerPoint just on the process. Let's see. Can you guys see that? Okay,
Looks good. Yeah.
great. Let me see if I can just start sharing. So I'm working with Southwest. Sorry, my camera is not the best, but I'm working with Southwest right now as a prevention policy intern, as Kellen mentioned, and we're working to put together position sheets and voting record and just culminate that and make sure that we have as much information as we can so that we can go and visit, well, not visit, but virtually visit and talk to representatives who might need more information on legislation for prevention. So a little bit about my background. I was a not prevention policy, but a policy and legislative intern for the legislator last session. I worked for Representative Walt Brooks, and I also was the legislative liaison for Dixie State University's Institute for Social Research. In both positions, I tracked legislation and observed the legislative process, so I really had a hands-on approach. So I'm very familiar with the legislator, and I'm still involved even in this year. So if you guys have questions about that, just feel free to reach out to me, and I'll include some resources for you guys at the end. In addition to the legislator, I also have policy experience. I am currently a policy and legislative intern for the Sutherland Institute, which they look at education and healthcare policy, which is a little bit different than Southwest, who looks at prevention policy. But either way, I study this, and I'm constantly reading bills and legislators studying their behavior throughout the session. So just kind of what I want to go over in this presentation is just the public health prevention model, just to start there, and then go over the legislative steps and some terminology that I'm familiar with, and you guys might be familiar with too, but just it helps to refresh everyone's memory. And then also go over my bill spreadsheet that we're working on at Southwest, and then I'll provide some resources at the end. So I'm sure you're all familiar with this public health model, but just to refresh your memory, there's the tertiary, the secondary, primary, and primordial. The tertiary acknowledges that there's already a problem, and they try to prevent it from prevent it from spreading any further. The secondary is taking steps when there are minor problems before they become larger issues. Primary are measures taken before the problem happens. And then there are the primordial, which looks at policies overall and tries to prevent problems from happening. So that's kind of what I'm going to be talking about, is that primordial prevention. So just a little a 10-step process for the legislator. You'll start with proposing the idea for a bill, and that could be through initiatives that you guys are working on now, or meeting with legislators before the session starts, and then going on to draft the bill with policy analysts. And then once they've drafted that bill, they'll introduce the bill to House Rules Committee or Senate Rules Committee. They'll then assign the bill to a standing committee, which could be like education or government operations appropriations. Then they will introduce that bill to the floor and then debate the bill. Once the bill has passed both houses, it'll be enrolled into legislation, and then the governor can either veto, sign it, or he can go without signing it. It could still become a law even if it's not signed. The lieutenant governor can also sign it as well. But I think it's just important to point out that first step is proposing the idea, because once the session gets started, it's kind of hard to introduce new bills. So making sure that you're staying in contact with legislators and making sure that you're being a part of the initiatives and doing your research is so important before the session starts. And even when the session's going, to have that idea of what you're wanting to do for the bill, or maybe any amendments that are needed. So now I'm just going to talk about some terminology that you'll see on the spreadsheet. I talk about a bill proposal, which I mentioned before. It's just that proposing the idea to the legislator, and once it's brought to the legislator, it is now a bill proposal. Then you have a bill request, which is that proposed bill that has been drafted but might not be public yet. After it's a bill request, it'll be numbered and go through the legislative process. You'll also see on the sheet, you'll see a Y, N, a backslash, and NP, which I made it simple so that when you look at it, just green, it means yes, they're in favor of it, they support it. N would be no, opposed, not in favor. A backslash might be not voting, or they're absent during that session or during that period. And then NP, which that doesn't really apply to the legislators as much as the positions for coalitions or associations. They will sometimes put no position. And then also a scorecard, I refer to that in this presentation, and then also inside of the spreadsheet, which is just basically the percentage of overall yay votes or related votes from their voting record. So if a legislator said yay to 98% of the prevention bills, that is their score. That'll be reflected on the scorecard. Okay, let me just move this. So now onto my spreadsheet, and I can include the link. Let me put it in the chat so that you guys have it. 1 second. So that's just a link to the spreadsheet if you guys want to reference it. Basically, how I've organized it is with the bill name, the sponsors, so that will be the floor sponsor, which will be the opposite. So if it's a House bill, then the Senate will be the floor sponsor, and then vice versa. And then I also have the appropriations that'll be listed on there for the 2021 bills. USEV's position, which is just the Utah Substance Abuse and Mental Health Association, and then any positions that you all might have and might want me to include. And then you'll see from that point on the rest of the legislators, and I have it separated by last name. So you'll see A through Z, each legislator after that. And then in the bill section, you'll see bills that range from substance abuse to marijuana to mental health, which the Speaker of the House did mention a lot yesterday in his address. So I do see that there will probably be a good amount of mental health bills this year. Alcohol-related bills and prescription medication. In the sheet, I did take the time to kind of calculate the total number of Senate and House bills, and then you'll also see in the tan color both from each year. So from 2016, it increases a lot, almost by actually, yeah, about double the amount of bills. So prevention legislation is just getting better, and they're increasing the amount that they're putting into prevention and wellness bills, which is great news, I think. In 2016, they had only 49, and then 2018 almost doubled to 80. Then you go down a little bit in 2019, and then increase right back up again in last session, which was 79. And then we also found that a lot more of the legislators are voting for prevention legislation too. In 2016, there were only 15 total that were voting for it that are from this current session, and then you see, 7 that were in support of it. And then you see an increase in 2020, 15. So this number on the side, the green bar is the darker green bar is the total number of legislators that were voting that year. So there were about half of the legislators voted for 90% or above for prevention legislation, which is great. And even in 2020, about 40% of the legislators voted between 70 and 90%, which is really great too. And you even see an increase from 2016 to 2020. And so I also wanted to highlight some of the legislators who had the lowest scores, because those are the legislators that you might want to reach out to just for this coming session, and maybe give them some more information about prevention, and maybe they're not understanding, or they just need more education on it. So in 2016, Iwamoto voted for only 22%, and granted, only a majority of her bills that she didn't vote for she was absent for. So I think that she might have been sick or something of that sort for that session. That's why it was so low. Stevenson, he had 61% in 2017. Anderegg and Okerlund in 2018, which similar situation for Okerlund. He was mostly absent for the 2018 session. So I think there was some sort of other circumstances going on besides just not voting. And then 2019, Hemmert, Ibsen, and Stevenson again had the lower votes. And I think Stevenson is somebody that maybe we're starting to see a trend. So maybe contact him and try and get him on board, or provide some more research-based information about prevention. And then also in 2020, McKay, Milner, and Hemmert were among the lowest scores. But even so, you still do see an increase from 2016 to 2020. So I see that more people are starting to vote for prevention and wellness bills. And then also, it's important to look at the highest scores too. Those are going to be your advocates for prevention and wellness legislation. You'll see in 2016, Hilliard, Maine, and Wheeler had above 95%. Then you see a huge jump in 2017 where Milner, Bramble, and Buxton had 100% of their yay votes were going toward prevention legislation. 2018, Ibsen, Hemmert, Maine, they were among the people who voted for prevention legislation. 2019, Hilliard, again, you see Maine and Hilliard. That's kind of a trend. So they're big proponents of prevention policy, and Reeb. And then Winterton, Vickers, and Hinkins. In the spreadsheet, you'll see that I highlight some of the highest number of sponsored legislation. So these are the senators and representative that are sponsoring legislation that has to do with prevention. So those, if you have an initiative or needs to speak to someone to run a bill for you, the people who have done it the most, I guess I should say, are Representative Ellison. For all 5 years between 2016 and 2020, he ran the most bills from each session. And then it was kind of tied between Wheeler and Bramble for senators who were in support of and sponsoring prevention legislation. All three of them have above a 90% score for prevention. So what you could do with this information is like, I can't remember her name. Kate, is that what her name was? She was just on here. She was speaking from Yusuf, but as she was saying, you can contact legislators, and that is going to be huge this year because of how everything's being done. And I know I have a contact list on the spreadsheet that I did include. It has the email address and the phone number of the legislators that you can contact. It doesn't, however, have their district, so you'll want to go to the Utah website. That's le.utah.gov for, you can put in your zip code and find exactly who your representative and senator are, and then try and get to know them and contact them. And then next, you'll want to try and speak with them after, obviously, you have looked them up and you're trying to get to know them. Speak to all of them, but specifically the ones with the lower scores. And again, if you want, I can share this PowerPoint. If you want, you can write down the names or take a screenshot. It's also on the spreadsheet, so they're highlighted. All of the lower scores and the higher scores are highlighted. And speak to them and try and educate them. And then you'll also want to provide them with meaningful and research-based knowledge. I know many times when I was sitting in a meeting with a representative and they would say, well, I had no idea, or I wish they would have given me more information about this. So it's really important that you're providing a research-based emphasis on that, and meaningful information to them so that they can apply that and how they vote. So it does affect how they vote. And then here are just the resources that I was telling you about. Yeah, so yeah, I'm just looking at the chat right now. I can send the PowerPoint to you, Kellen, and then she can send it out. Is that okay? Okay, awesome. Yeah, and then these are just the resources. Like I said, the legislative website, I can't get enough of them, always on this website. It has the calendar for all the committee meetings, recordings, like, I can't remember her name, but the lady from Yusuf, as she was saying, it has everything on there that you need. Live recordings, audio recordings. It has the roster for both Senate and House bills. It has the archive for all of the bills, dating back to, I want to say, the 1980s. It has everything that you need. The Constitution, Utah Constitution is on there. And then also the Office of Legislative Research and General Counsel is a great resource. They are the ones who really are writing the bills. They are in contact with the legislators and they will do amendments. They have the attorneys and their counselors who look over the bills before it gets sent out to the floor, and they're constantly making changes before it is actually made public. So they're good to keep in contact with too. And then I also reference Yusuf and their page quite a bit, and I think she also already provided that link for you guys, but again, I'm going to share the PowerPoint so you guys will have it. And then just, you can reference also this spreadsheet that I have. It has the 2021 bills that I'm updating right now. And if you have suggestions, please email me. It has bills of interest for prevention and wellness, and then the 2016 through 2020 bills. And like I said, that contact list for all of the legislators. But yeah, that is all I have. I don't know if anyone has any questions for me. Like I said, this PowerPoint, I'll send it to Kellen and she'll send it out. And yeah, thank you guys for having me.
That's great. Thanks, Elena, for coming and for showing us your spreadsheet. I'm going to use the last 8 minutes here to show you all le.utah.gov, which Elena and Liz have both referenced. So I'm going to take over here. I'm sure a lot of you know how to use it, but just as a refresher and just to take back to your coalition members or to show your youth, I have slides to walk you through this that I can send out too, but just in the interest of time, I'm just going to do it quick. And then if you have questions, my contact information is in my slides. So the first thing I wanted to show you all is just how to identify your legislators. I'm sure you all know who your legislators are, but for instance, I'm new to Utah, so this is a really useful tool. And also if you run a coalition or coordinate a coalition in an area you don't live, then this is great as well. So if you go to the le.utah.gov homepage, you can just click legislators on the top tab. And then in the search, I like to do it by address map. That's just the easiest way. And then you'll see I've done this a few times. It remembers my address, but this is the address for my work office. And then if you click find, it pulls your representatives right up. If you run a coalition or coordinate a coalition for an area that's, for instance, a whole county, they do have maps that separate the state out by district. So then you might have to do it that way, or possibly have your members do their separate addresses because it might be a little more complicated. It's a little bit easier for Magna, but if you have a whole county under your belt, it might be a little more complicated, but that's just the easiest way to do it. And then you'll know what districts you're under that way as well. So, and then the second thing I wanted to show you is an easy way to track bills. So if you're interested in any of the bills that Liz mentioned and you want to kind of track how they're moving through the process that Elena walked us through, if you create an account on le.utah.gov, you can click bills at the top here and then go over to bills. Oh, I'm not trying to highlight all that. Bills, bill requests. And it will automatically put you in the 2021 general session. And then you can search by senator or rep or subject, and you can search whatever you're interested in. So we all know that prevention is in a lot of topics, and there's unfortunately not a prevention subject here, but I will scroll down to substance use, which is, of course, in 3 different sections, but and then you can see that I'm tracking 3 bills right here. And so what happens is if I were to click on this one here, HB 73, it would show me who's the bill sponsor, who's the floor sponsor, and then I could read the bill. And if I click track, then when I go to my home page, you can see all the bills I'm tracking, and I can see where they are in the process. And so it just makes it a little bit easier if there's certain bills that you're interested in. And if you're really into it and kind of nerdy like I am, then you can click email all bills and you'll get email notifications about the bills as they move through. And so if you're really interested in keeping track of any of the bills Liz mentioned or any of your own bills, then that's a good way to do it. If you want to see, Senator Thatcher is the Thatcher for the district that Magna's in. So I'm trying to keep up with those specific reps and senators for my area. So that's just a personal interest of mine. And then just a few extra resources for you all at the end. And I'll send these out with Elena's slides as well. This has just a ton of PDFs on how to read a bill and how to, like, speaking points for when you go talk to your legislator. Some of it's way too much information, but if you're looking for handouts to send to coalition members or to do like youth coalition meetings in the next month before Capitol Hill, there might be stuff there that you're interested. So look on that. I know Elena put together a list of House and Senate emails, but this is also the emails for the 2021 House interns. And that's also a really good way to get a hold of your legislators is to reach out to the interns. So this will take you to the website for your reps, and then this specific link will take you to the website for the interns' emails. And then last but not least is just that Capitol Hill Day is on February 18th. I will send you some handouts and talking points before then. And I know that it doesn't seem as fun that we can't go up there in person this year, but we have a really unique opportunity that we can be there via Zoom, and we can be calling them and emailing them, and that more of us can go because we can do it from the comfort of our own home. And if February 18th isn't a good day for you, you can do it on February 17th. Nobody said you had to do it on February 18th. So if you have questions, or you want to talk about policy and advocacy, or you want to talk about a bill, I could talk about this stuff all day. So please call me, please email me. I will pick up. I will talk to you for hours. And yeah, just reach out. And I hope you learned something new today, and have a great rest of your day. That's all I have, Teresa.
Thank you so much, all of you, Alina and Kellen, and also Liz, who I think had to jump off. But my goodness, what a really, really good, well-rounded webinar on policy. So thank you so much. And I think we're super fortunate to have Kellen in our policy position, because she's got a lot of experience there too. And so for all of you, thank you so much. I just want to remind you to sign the roll. Also, I appreciate Robin's suggestion to send out a thank you to those who have been supporting in our prevention policy, because I think that helps them understand that we appreciate all the things that they're doing. So take a minute to do that if you have a chance. And then also, I just wanted to announce the dates for Bryce. We are crossing our fingers that we'll be able to hold the Bryce Summit in person this year. But put the dates, June 16th through the 18th on your calendar, and hopefully we will get to see each other in person there. So thank you everyone so much. We'll be sending out those slides, and we will see you next month.
Thank you, Teresa. Thanks, Kellen.
Thanks, Elena, for coming. I really appreciate it.
Of course. See ya.